Hello, I'm Amanda Summers with SSI Physical Therapy, and we're here doing the March segment for Greer Now magazine. And the topic for this month is basketball and injuries for basketball. It's March Madness time, so we want to tell people a little bit about how they can keep from getting hurt on the court. And with me today, I've got my business partner, Lance Owens, and Lance is also an athletic trainer and worked in the basketball arena for years. So Lance, tell me a little bit about what kids and athletes can do to keep from getting hurt while playing basketball.
Well, I don't think people realize how many injuries there are in basketball. 1.6 million injuries are reported every year in emergency rooms and doctor's offices that are basketball related, and most of those are the knee, foot, and ankle. So I think it's very important to try to do something to prevent basketball injuries. And the best way to prevent a basketball injury is through prevention and training.
Well, what kind of prevention and training? You know, you hear so many stats about girls getting injured versus boys. What kinds of things can these athletes do to keep from getting hurt?
What they can do is properly train early. And right now we suggest preseason training that focuses on strength, agility, and balance. Most of us know about strength training.
Right.
But, what most athletes lack right now is agility training, which helps them with their balance and their proprioception so that they're not as likely to twist an ankle or twist a knee while they're going through the movements of basketball, of jumping, running, and landing.
Now you say proprioception. What does that mean?
That means knowing where your body is in space. That means being able to quickly react to your ankle starting to turn or your knee starting to twist. Your muscles engage quickly to prevent that from going so far that you tear a ligament.
So is that kind of like when they're driving down the court and go in for a layup but then do a quick pass off to somebody and change in that direction, so you can train them so that they can do better at that type of movement?
Absolutely. You can train an athlete and you can train a muscle to react more quickly to prevent an injury to a ligament.
Okay, well, what type of training do you do with that? I mean, how do you train somebody to do that?
Well, we start at the beginning. We start with basics, and we train people to use good mechanics. We go all the way down. We start out slow, and we gradually build them up quickly, retraining and teaching their body how to do things using proper mechanics.
Now, I've done a lot of reading and some research with this, especially with females and jumping.
Right.
What are you, and done some training with females jumping and landing. What types of things are you looking for in girls, especially with their landing, so that they don't get hurt?
Well, the number one cause of girls having ACL knee injuries is the way they landing from a jump. And the problem is, the thing that we want to try to prevent is the knee going inward, or not knees. Most people just think girls are made that way, but that's actually training of the muscles. And as girls are growing and going through puberty, their bodies begin to change, but their muscles don't keep up with that. If we can retrain their muscles, they land with better mechanics, which significantly decreases their chance of having an ACL knee injury.
Okay. And then with ankles, I get a lot of parents that are calling me and stuff wanting to know about ankle braces. You know, can they get an ankle brace to prevent their kids from spraining their ankle? What do you think about that?
I don't like ankle braces to prevent an ankle injury. I think what happens there is they become dependent on the ankle brace, so the muscles are being trained to not work. They're depending on the ankle brace. They're out in the yard one day and they're not wearing their ankle brace, and boom, they twist their ankle, because again, those muscles are deconditioned. We do suggest ankle braces after an ankle injury while they're going through rehab to re-strengthen and regain range of motion of that joint. Okay,
well, that sounds good. Any other things, or where can, if I was a parent and I was looking for something and wanted to keep my kids from getting hurt, where is that something that you've got here that you're going with?
Absolutely. We do preseason training for almost all year and almost all sports, where we bring kids in here and we break it down to the simplest form to retrain those muscles to prevent injuries and also make them a better athlete, make them quicker, more nimble, and stronger in their sport.
Thank you for visiting us today at Greer Now TV Health and Wellness segment. We hope you enjoyed what you've seen. If you have any questions about these programs or other questions, please contact us at 801-8706 or visit us on the web at ssiphysicaltherapy.com. Thanks, and have a great day.